Although seldom used, medicine balls make an effective form of resistance training for the rotator cuff musculature. First, I will demonstrate slower or strengthening type movements for the rotator cuff, and then we will progress to faster movements with the rebounder. What we do is align the patient or athlete in a side-lying posture with the humerus aligned with the long axis of the body. And now we're going to perform an external rotation. You see here we're using a small 1-pound medicine ball due to the fact that many people have very weak rotator cuffs. I've worked with professional bodybuilders and strength athletes that could only handle very small weights when the rotator cuff was isolated. One precaution you should always make is never allow the psychological portion of the athlete to override the physiological portion of the athlete, because most of them will want to use more weights than they can handle effectively. Now you can see that she is using external rotation exercises to isolate the infraspinatus and teres minor musculature. With this exercise, your maximum resistance is when the humerus and the forearm are parallel to the surface of the earth. So what we want to do to change the force on the length-tension relationship of the muscle is bring the body forward. Now, when the forearm is parallel to the surface of the earth, the muscle is in a shorter position. So we want to break up the position in which we perform the exercises, working for 2 weeks approximately to 3 weeks in one position, and then changing positions, or breaking the sets up. One set in one position, another set in another position, and another set and finally another position, to put your strengthening across as much of the force-length relationship or the force-length curve as possible. So here we'll demonstrate the exercise from a forward rotated position, and then a neutral position, and then we'll rotate her body back, which will load the muscle at the beginning of the range of motion. And then, using this same principle, we can progressively increase the speed of movement. We'll now go to concentric only tosses, to concentric eccentric. Medial rotation exercises can be performed with the same concept. At the neutral position of the humerus, we perform medial rotations. And then by progressively changing the alignment of the torso, we change the position on the force-length curve at which the muscle is loaded. And then, of course, we can bring the body all the way towards the shoulder, which will then change the position of the force-length curve again. We can once again go to concentric only tosses, to concentric eccentric tosses. That's better. Once again, we can go from concentric only tosses to concentric eccentric tosses. And when you're performing your concentric eccentric tosses, once again you want to change the position of the body. And of course, progression is both in speed of movement and the weight of the medicine ball used. We will now perform rotator cuff exercises in functional positions away from the neutral position, progressively going further into shoulder abduction. Whenever there's a problem with injury or pain, you should always begin your rehabilitative exercises in the scapular plane, which is identified as 30 to 45 degrees forward of the midfrontal plane, which would be here, and slightly below 90 degrees to prevent aggravation of the humeral structures under the acromion. So what we will do now is begin our strengthening exercises with slow external rotation. And once again, we can change the point on the force length curve at which the muscle is loaded by changing the position of the torso. And get ready. We can once again progress the exercise from a concentric only to a concentric eccentric exercise. Medial rotation exercises for the subscapularis muscle are performed with much the same progression. We go to the scapular plane below 90 degrees of abduction, and we start off with concentric only and progress to concentric eccentric. We can change the position of the overload medial rotation by throwing the ball into different positions which require her to move her humerus into different angles. At this point, I would like to demonstrate how the EFI Total Gym Rebounder can be effectively used to condition the rotator cuff both in the neutral position and progressions into shoulder abduction and in the frontal plane. Once again, we will have the option of performing concentric only and concentric eccentric exercises, and I will take you through both medial rotation and lateral rotation exercises. Here you see the concentric only medial rotation. You can also change the position of the body. Now we can progress into variations of shoulder abduction, as many functional positions as you want. For instance, when you're rehabilitating a baseball player, you must incorporate a lot of eccentric work because the outfielder or the shortstop or any of the base players will have to catch the ball at all different positions, which would represent an eccentric load. So we'll work in a variety of different hand and shoulder positions. The external rotators of the shoulder can be trained in much the same manner. We can start concentric only. And work to concentric eccentric and vary the positions of the shoulder. This position represents a functional eccentric load for the external rotators of the shoulder, which is very important when rehabilitating baseball pitchers, golfers, anybody that has to decelerate the shoulder at rapid speeds. Medicine balls can be effectively used to strengthen the wrist extensors and the wrist flexors. They create a nice handhold or a functional handhold position. Many situations such as carpal tunnel syndrome have been thought to be related to imbalance between the wrist flexors and wrist extensors. Not only do you have carpal tunnel syndrome that may be related to the imbalance, but oftentimes lateral epicondylitis is suspected to be due to an imbalance between wrist flexors and wrist extensors. To begin your strengthening program with a medicine ball, it's a good idea to straighten the arm as much as possible, stabilize the arm, and take the ball of the appropriate weight, which is determined by the therapist or coach, and go through a wrist extension motion slowly and steadily. Remember, the tempo that the exercise is performed at has a great influence on the outcome of the exercise because time under tension is a key factor in strengthening any muscle. To strengthen the wrist flexors, simply turn the hand over and work the musculature. Now, many conditions, such as a carpenter where there is ballistic action of the hand, or a tennis player where there is ballistic racket action, will benefit from a progression into faster movements of the exercise. In the clinical environment, I recommend starting off once again with the concentric motions first. So we stabilize the arm and perform the concentric wrist extension in a ballistic fashion. This is very important, once again, in sports or work environments where there is repetitious movement of the hand and wrist. Now, a progression from the concentric only movement is to concentric eccentric loading. In cases of tendinitis, I highly recommend that a qualified therapist progress the exercise because it can recreate a tendinitis if done too aggressively. The concentric eccentric motion is performed by throwing the ball and catching it. You want to try to minimize the movement at the forearm to overload the wrist extensors. The same can be done with the wrist flexors. The exercise can be done in radial deviation. And it's very hard to do an ulnar deviation dynamically because it's hard to catch the ball, but ulnar deviation can be comfortably performed with a medicine ball. And changing the position of the hand changes the point at which the muscle is overloaded due to the fact that you change the force-length relationship in the muscle. So for instance, here you're going to get an overload in a shortened position, where here you're going to get an overload more of a lengthened position, and here you'll change the position of the overload entirely. Greatest resistance is here with the arm high, and the greatest resistance is here with the arm low. So it's a good idea when doing these strengthening exercises to change the position of the extremity, to change the point of the force-length relationship at which maximal overload occurs. In many sports, such as martial arts, baseball, and wrestling, you need to have quick, strong hands. In search for an exercise that would effectively strengthen the finger extensors, I developed the finger flicker exercise. I found the Total Gym testing grid system to be very useful for determining how much strength the individual had, as well as recording progression. We start off with a light ball, like 1 or 2 pounds. Here's a 2-pound ball. Now, Jackie will effectively demonstrate finger extension strength by flicking the ball, and I will monitor how far the ball rolls. And as you can see here, she makes it to the 70 line. Once Jackie can progress the ball all the way out to the 90 line, I will progress her to a 4-pound ball. And now you see she's only able to make it to the 30 line, which would be a significant increase in the resistance, and then an overload of 6 would be too much at this time, but she makes it to the 20 line. So this exercise is very effective for developing not only strength, but explosive power in the finger extensor musculature, which is very important, especially in situations like law enforcement, where you must have the ability to generate power quickly for hand-hold positions to control an opponent, etc. Unlike a dumbbell, a medicine ball can be thrown, making it an excellent form of resistance for training the elbow flexor musculature. The medicine ball can be held in a neutral grip, which will activate the brachioradialis to a greater degree than the supinated or pronated position. By tucking the elbows into your side and working the medicine ball, you can do slow, controlled movements for strength training, or you can do more dynamic movements for ballistic conditioning as you see here. You can change the position of your body and the position of your arms, which will change the position at which you get maximum overload in the force length curve. Now, if you change the grip to a supinated grip, you get more activation of the long head of the biceps. You can do strengthening at slow speeds, and if you'd like, you can use a much larger ball. Here we have a 25-pound ball, which will provide a significant overload for most people in the rehabilitative community. These balls can be purchased all the way up to 60 pounds. So we're using a supinated grip for the long head of the biceps, a prone grip, or a neutral grip to get the brachioradialis. And then, if you'd like to activate the brachialis more effectively, we need a smaller ball, but you attempt to catch the ball and work the ball in a pronated position. You can hold the ball and work it like so into elbow flexion. And then you can throw the ball and catch it in that pronated position. Try to keep the elbows fixated to the torso to force the elbow flexors to work more. Once again, you can change the position of the body to change the position and the length force curvature that the overload is obtained at, like so. You see here, your maximum load is placed on the joint, whereas when you're standing, the elbow is bent to a greater degree. If you were to look at me from the side, you'd see maximum load is here versus here standing. So this changes the point in the force-length relationship that you get your maximum load on the muscle, which is essential because most people use one pattern of movement or one type of exercise to condition all different types of muscles, and that may not have the highest degree of carryover to your work or sports environment. So I recommend closely analyzing the work or sport environment that your patient or athlete is returning to. You may want to spend more time in different positions. For instance, if they spend more time in this position, then you want to condition them in that position. The same biceps exercises can be performed with one medicine ball using single arm action. It's well known through research that you have what's called a bilateral deficit. You can produce less strength with both arms comparatively than you can with one arm. So whenever you're trying to get maximum recruitment of muscles, especially when working at higher speeds of movement, if you can go to a single joint action, you're going to get more bang for your buck, shall we say. So what we want to do here is demonstrate once again. You can do the supinated position to get more long head of biceps. If you want to start off and stick with the therapeutic progressions we've talked about earlier, going from your strength moves, which are slow, to your concentric only moves, to your concentric eccentric, that would demonstrate a progression. This type of exercise can be very effective for somebody that has an unstable glenohumeral joint. Now, we did the supinated position. We can also do a neutral grip. So you throw the ball up and you catch it in that neutral grip, which will give you more of a brachioradialis type overload. And then you can turn the hand over into the pronated grip. And once again, now you're working primarily your brachialis muscles, and your strength will be reduced in the pronated position by as much as 1/3. This will be more noticeable when using high resistances at slower speeds. Once again, the hand position should correlate to the work or sports environment. An athlete such as a tennis player that must manipulate hand positions on the racket should be reconditioned in the supinated, neutral, and pronated positions. When you're performing these catch and curl type exercises, if you change the location of where the ball is caught, then you will then load different portions of the muscle. For example, I will catch the ball high. And by catching the ball high, I'm generating a quick load in the muscle at a very high angle. So the muscle is loaded at that joint angle. If I catch the ball at a medium height, the initial load is taken here, and if I catch it at a low height, the load is taken here. There's a lot of neuromuscular specificity with these exercises, and you don't want to once again fall into the trap of conditioning at only one joint angle. I'll demonstrate a high catch, a medium catch, and a low catch. And they all feel different. Medicine balls can be effectively used to strengthen the elbow extensor or triceps musculature. Just as I mentioned in the biceps section, hand position has an influence on which head of the triceps is the predominant prime mover. What I'd like to do at this point is demonstrate several different triceps exercises. Remember, it's important to change the position of the humerus because that will change the point in the force-length relationship at which the muscle is loaded. The rebounder can be effectively used to bring the ball back to you. Now, I also want to remind you that you must pay attention in the rehab situation or the clinical situation to, if you're doing strengthening exercises, the ball moves slowly. If you're progressing into faster speeds of movement, we do concentric movements only, which for instance would be a concentric triceps extension caught with the other hand and then repeated. Then you do concentric eccentric loading. Now, using the rebounder, what I want you to notice is that I fixate my upper arm to my body to create more of an overload on the triceps and decrease contribution from the surrounding muscles. We're going to start with a pronated grip, and then we're going to switch to a neutral grip and go to a supinated grip. Now, when you change the grip position, you will definitely feel how it changes the location in the triceps at which you feel the majority of the stress. Now, you can also change the way the arm is activated by getting closer to the rebounder and then moving away, which changes the position of the humerus, once again changing the point of stress. As you see, close to the rebounder, the elbow is in a neutral position, or the humerus is in a neutral position. And then as I move away from the rebounder, the arm is held in flexion, which will have a significant influence on the long head of the triceps, which crosses the glenohumeral joint. From a supine position, triceps extensions can be performed with a supinated grip from the French curl type position. And then you can go to a neutral grip where the hands are on the side of the ball. Notice that Jackie is keeping her humerus in a fixed position. And then we can go to a prone grip position, or a supinated grip position. And you will feel once again with these strengthening exercises that it will change the location of stress in the triceps. If you're wondering which hand position stresses which muscle group more, simply work the exercise to the point of fatigue and you will feel it the next day. Now, we can do straight pressing movements, and now she's going to perform the exercise with a pronated grip. And this would mimic a bench press type position. We can go to a neutral grip. And then we can go to a supinated grip. And once again, pay close attention to the fact that the first set of exercises were performed at approximately 160 or more degrees of shoulder flexion, where now she's performing the exercise from approximately 90 degrees of shoulder flexion at end range. Point being is that you don't want to stick to one exercise for the entire duration of the strengthening program because you're limiting yourself to overload at one point on the force length curve. Now, you can progress these exercises to become more plyometric. The exercises can be progressed not only by increasing the weight of the ball, but the speed of the movement. Once again, you can go concentric only, and you can progress to concentric eccentric. Now, the balls can be pushed higher towards the ceiling, which makes it more of a ballistic exercise, and then it can be progressed all the way to a maximum effort. Great. Precautions to the triceps extension exercises demonstrated are going to be diagnosis specific and tissue loading specific. Of course, if you have a muscle tear or a tendinitis of the triceps at the elbow, or which is a rare tendinitis at the long head of the triceps as it crosses the glenohumeral joint, then you're going to have to select your exercise repetition and loading scenarios carefully, and this should be dictated by a physical therapist or a doctor. Now, if you have instability of the glenohumeral joint, once again, you're going to have to be very careful about the selection of your exercises and about how dynamic your exercises are. But the important factor with instabilities is that you keep the humerus fixed and work the elbow joint, and you should have minimal trouble. And as one progresses and their stability increases with specific stabilization exercises, then you can start incorporating shoulder and elbow joints in the same movements, which would then be called a compound exercise. Some of those will be demonstrated later. Another key point here is maximum tissue tolerance. If somebody has a maximum tissue tolerance, which is demonstrated by pain with a 4-pound ball, then reduce the weight to a 3-pound ball or a 2-pound ball, but there should never be pain with any of these exercises. To effectively isolate the deltoid musculature using a medicine ball, we want to straighten the arm and go into shoulder flexion. That will isolate a lot of anterior deltoid. Now, you're going to have all your scapular rotator musculature involved, but if you would like to get some deltoid strengthening, you can once again use the medicine ball in place of a dumbbell. It's all right to use a dumbbell in your slower phases, but I will demonstrate both strengthening and dynamic exercises with the medicine ball. Many people, I especially find that females prefer the medicine ball over the dumbbells, oftentimes even for the psychological reason that they do not like weightlifting, but they will perform the exercise with a medicine ball. So remember, 6 pounds is 6 pounds no matter what. If they want a medicine ball, hey, I like them, let's use them. So the anterior deltoid is exercised through shoulder flexion. If you just palpate the muscle, you can feel there's a lot of activation. What you want to do here is keep your hand in the neutral position, which will aid in activation. So you put the ball in your hand and fixate the hand and arm in the neutral position. The medial deltoid will have dominance in the straight abduction position. Remembering also that your speed of movement or tempo has a big influence on the outcome of your strengthening exercise. And then the posterior deltoid can be activated with extension, and changing the position of the torso once again changes the point in the length force curve at which the muscle is overloaded. Your maximum resistance will be here when the torso is forward, and your maximum resistance will be here when the torso is upright. I will now demonstrate dynamic exercises for the deltoid musculature using a medicine ball with a partner. Remember, as I've previously outlined, you always start your dynamic progressions with concentric only and progress to concentric eccentric. We will demonstrate here the concentric and eccentric portion of this program. Our first exercise is shoulder flexion. And then we'll go to shoulder abduction. And we will now go to shoulder extension. To minimize use of the triceps musculature, keep the arms straight, which will force more deltoid activation. The lateral deltoid can be effectively activated with horizontal abduction movements. Once again, you need to minimize bending of the elbow. The posterior deltoid can be activated with horizontal abduction. And the anterior deltoid can be activated with horizontal adduction or adduction. And once again, these are obviously not exercises that can be performed with a dumbbell, unless you have a very good insurance policy in your clinic or gym. At this point, I would like to demonstrate compound upper body exercises. Compound meaning multiple joints. The chest pass will be our first exercise. The chest pass is not really used as a strengthening exercise, it's for developing power. Chest pass exercises are great when combined with bench pressing or weight training due to the fact that they can be performed at high speeds of movement, which has greater applicability to sports performance. We're going to start with a 10-pound ball, and then we will demonstrate progression to a 25-pound ball. It's always a good idea to start slow and just get your joints warmed up, get a movement-specific warm-up. Once you've got your rhythm, you can start progressively increasing the explosiveness. To get a plyometric effect, you want to try to not stop the ball. In other words, don't stop the ball and then throw the ball. If you stop the ball, it takes the stretch reflex, cancels it out, and it becomes strictly a push exercise. Whereas if you explosively pass the ball to your partner, you can take advantage of the stretch energy in the triceps musculature and chest musculature. Now, one of the progressions, as I mentioned in the basic science section of the video series, is that if your speed drops down below the target speed you're trying to achieve, or it looks like your form is dropping off, then you may need to go to a lighter ball. You'll notice with a heavier ball, we will not be able to perform as many repetitions because you'll get tired much more quickly, your speed will drop off, and then you'll be training yourself to be slow. Watch closely. You have to pay close attention with this exercise. If you fall asleep, you're going to get hurt. The ball will hit you in the head. When you're in a competitive situation with a partner of your ability, the object is to go as fast and as hard as you can, fast enough that you outdo your partner. The competitiveness brings out the maximum in you. Start off slow and easy. I'll demonstrate. As you pick the pace up, you go. Then you start hitting terminal velocity, and you stop when your form drops off or when someone misses the ball. Don't use too heavy of a ball. Now, I'm going to pass the ball to Jesse. I'm going to do this slow so I can explain some key points. I'm going to pass the ball to Jesse, and while the ball's in the air, I'm going to come down. Now, when you're down here, your body should be straight. You don't want to be doing these wimpy push-ups. Now, if you find your partner's throwing the ball up over your head a lot, it means you're too close together. If you're having a hard time getting the ball to your partner, you're too far apart or you're getting tired. All right, so you start off slow, progressively get faster. Jesse and I will demonstrate one set in real live action. Ready? Smooth and steady, and we'll pick it up. All right. Precautions with the chest pass are related to horizontal abduction of the shoulder. If there are any precautions due to joint instability, especially with anterior capsular laxity, the therapist should be very careful as to how much range of motion is allowed in horizontal abduction with the chest pass. The exercise can be performed starting with limited range of motion and then progressing as tolerated. Okay, the next exercise, the first of the two in the superset, is an oblique toss combined with a push pass. This is what it looks like. Starting on the side. You're going to do 5 oblique tosses. One person should be responsible for counting, or it always gets screwed up. Here's how you do it. Start with the knees bent. Don't round your backs. Good upright torso. The ball should be thrown out in front of your partner. The reason for that is if you catch it here, it stops your momentum. You want to get the plyometric effect or the stretch effect on the oblique muscles, which stimulates the nervous system and helps you throw the ball quicker. If you stop, the ball has to be restarted. You slow down. So you catch the ball here, you absorb, and you toss. And notice that there's a lot of leg action involved. Don't try to do it just with your upper body. In no sporting situation do you just have a rigid upper body. So we want to train with movement patterns that as close as possible approximate sporting type movement patterns. So we're going to start off with 5 oblique tosses, just like so. It's going to be 1, 2, 3, 4, 5. Switch. 1, 2. Ballistic chest pass. 3, 4, 5. Switch. 1, 2. That's 3, 4, 5. All right. So once you do that, once you hit 5, you switch again. For those of you that have never done the exercise before, keep it to 2 times through the rotation. When performing the oblique toss, care must be taken when catching the ball not to flex the spine and then rotate. If you flex the spine as you're rotating, you significantly increase the chance of a lumbar disc injury and or exacerbation of an old injury. You want to keep the torso upright with a good solid base. You can rotate the torso effectively, keeping the trunk upright, but when you start incorporating a lot of flexion into the movement, your chances of injury will get higher. I'm going to demonstrate poor form for about 3 reps, then good form for 3 reps, so you can see the difference. From the bent over row position, which is the knees bent to at least 20 degrees, you want to maintain some lordosis in the lumbar spine. The head should be in alignment with the spine. You can perform a horizontal shoulder abduction exercise. This exercise will strengthen all the muscles required to perform the movement of horizontal abduction at the shoulder. The medicine ball, once again, is nice to use because it makes for a comfortable hand hold, and you have a variety of weights available to you with the medicine balls. To develop explosive strength, have the athlete perform horizontal abduction and release the ball. Medicine balls can be effectively used with the push-up exercise to increase the range of motion and aid in making this exercise more explosive for power generation. There are some precautions, though. Anybody that has a shoulder pathology of any type should be very careful when doing this exercise not to drop past the mid-frontal plane. Going past the mid-frontal plane puts excessive stress on the anterior capsule of the shoulder and may cause injury. Adequate shoulder flexibility is necessary to perform this exercise. This exercise is demonstrated as follows. Now, the wider the balls go, the more chest involvement there is. Bringing the balls closer together will make the exercise significantly tougher as this isolates the triceps musculature. Another variation on the push-up exercise uses one medicine ball. This exercise is very effective in situations where there's a lot of offense and defensive contact. The exercise looks like this. The military press exercise can be performed with a medicine ball at slow speeds for strengthening, or it can be performed explosively for power generation. We will demonstrate it slowly in here due to the ceiling height. Precautions with this exercise are related to the shoulder once again. If the patient or athlete has any signs of an impingement syndrome, the range of motion must be limited. The athlete may be able to perform the exercise if the therapist or doctor feels that the athlete is capable of performing the exercise with reduced range of motion. One way to limit impingement is by not pushing the ball up as high, but by pushing the ball more forward, which then approximates the chest pass. You go out of the chest pass and into the military press pass or push pass as your arms go higher. Once again, always be careful. If there's any pain, you should modify the exercise or change the exercise completely. For testing power generation, the total gym gait grid can be aligned perpendicular to the long axis of the body. The degree of power is determined by how far the athlete can throw the ball. The ball is from here. You throw the ball as you're sitting up. In other words, you throw the ball and follow it up. You actually do not want your legs coming in the air like that, because then what happens is you're using your abdominals isometrically, not dynamically, and you're also using a lot more hip flexor. Throw the ball explosively to the partner and follow it up all in one motion. It's important to have your tongue on the roof of the mouth while you're doing your exercise, because it strengthens the neck. It activates your suprahyoid and your infrahyoid muscles, which are your superficial neck flexor muscles. If you don't have your tongue in position, it overuses the sternocleidomastoid muscles and leads to poor posture. Tongue on the roof of the mouth, explode. Okay? 10 to 20 reps. Now you're going to superset that exercise.
You're throwing a 10 set now.
Yeah, you throw the ball first, and as you release the ball, you curl up. Okay? You'll feel it'll work your abdominals real hard. Okay? The back toss is an excellent exercise for developing strength in the shoulder flexor, trunk extensor, hip extensor, knee extensor, and ankle plantar flexor musculature. It's a great overall conditioning exercise for improving vertical jump and starting strength. The exercise is performed by taking the ball down into a squat start position. The elbows should be just inside the knees. There should be a slight lordosis in the spine. The head should be in alignment with the spinal column. Should not be up, should not be down. Eyes should be level with the horizon. This would be analogous with the power clean start position. To perform this exercise for strengthening, it can be done at slow speeds and looks just like this. It can be sped up slightly. You can include the plantar flexor muscles of the ankle just by going up onto the toes at the end of range of motion. This would mimic the explosive version of the exercise.
Everybody that's a partner should be watching their partner for their form.
The kneeling back toss is an excellent exercise as a segue from the standing back toss. By performing the exercise from a kneeling position, you eliminate the use of the ankle plantar flexors and knee extensors, which puts more load into the hip extensors, trunk extensors, and shoulder flexors. Care must be taken in the start position not to allow rounding of the back. Rounding of the back encourages overuse of the lumbar extensor musculature and may aggravate the lumbar discs. Performed properly, a lordosis is maintained. Keep the arms straight. And the exercise is performed. The exercise may be performed slowly for strengthening and explosively for improved power generation. The back squat exercise can be effectively performed with a medicine ball as opposed to the barbell, which often bothers a patient's neck. This exercise is very effective due to the fact that as opposed to the dumbbells, where you're going to have the weight at your sides, using the medicine ball up on the back has similar characteristics to using a barbell, which is a nice preparation for progressing the patient into the barbell squat. The exercise can also be done explosively, very comfortably. At this point, you want to maintain a lordosis, keep the chest high, drop down deep into the squat. Unless there's clinical restrictions at the knee, I prefer people squat as deep as they can possibly squat without flexing the lumbar spine. Once the spine goes to neutral, and hold, as long as there's at least a neutral spine, this is acceptable, but when the spine begins to go into flexion, the pressure in the disc rises. The squat can be performed slowly for strengthening, and you can progress the speed of the squat for power generation. The medicine ball can be effectively used to condition the adductor musculature when combined with the squat exercise. This affords you the opportunity to condition the adductor musculature in the closed chain, unlike the side-lying hip adduction exercises, which are commonly used for adductor rehab. The side-lying hip adduction exercise has a poor functional carryover to closed kinetic chain activities such as running, walking, etc. By using the medicine ball between the legs, we can activate the adductor musculature through the functional range of motion of the hip. The ball must be placed carefully so that when the athlete or patient is in the bottom of the squat, the knees track over the toes. So squat down. If the ball is too high, it'll force the knees out. If the ball is too low, they will pronate as they squat. If the ball placement is correct, the knees track directly over the toes. The patient or athlete should squeeze the ball through the entire range of motion of the squat. Ideally, I like the athlete to go on a 6-second concentric, 6-second eccentric cycle, which allows each of the 5 adductor muscles to have approximately 2 seconds of time under tension. As strengthening occurs, the speed of the exercise can be increased to sport-specific joint speeds. The front squat can be effectively performed with the medicine ball as well. I have found the front squat to be very effective in the rehabilitation of back pain patients due to the fact that putting the ball in front of the body causes a flexion moment on the spine, which encourages a more erect posture of the trunk. This minimizes flexion in the low back and allows people to do front squats that could not previously do back squats. This is what the front squat performed with the medicine ball looks like. The exercise can be performed slowly for strengthening and can be performed quickly for power generation. Because trunk rotation is an integral part of almost all sports movements, I'd like to demonstrate how the medicine ball can be used to combine a twist of the trunk with a squat motion. This is an effective upper extremity, torso, lower extremity integration exercise. The exercise can then be progressed with lateral hopping. The squat push press is an excellent full body exercise. The mechanics are similar to that of a squat, but it couples that of a military press or a push press. We would like to demonstrate how the squat push press is performed at a slow speed. Used at a slow speed, the exercise can be performed for the purpose of strengthening. The key element is synergy. The extension movements of the legs and back should be synergistic with the flexion movement or pressing movement at the arms. The exercise can be sped up for increasing power output. And then it can be coupled with a jump. Great. The squat push press exercise can be progressed using a total gym elevation platform. The beginning level of this progression would be to jump up onto the platform and step down as follows. An advancement on the exercise, which would provide more of an eccentric load, would be to jump off of the platform. The exercise can be further progressed by increasing the height of the platform. The lateral hop can be effectively combined with the squat push-press exercise, which has relevance to sports such as basketball, where you may not always jump straight up and straight down, but may need to jump up and move around an opponent. The exercise is performed as follows. There are a few precautions to the squat exercise that I'd like to point out. Most coaches and therapists spot the squat from the side, which only shows discrepancies in the sagittal plane. Your primary sagittal plane discrepancy will be excessive forward bending in the squat. If you place an imaginary bar across the athlete or patient's back, at the bottom of the squat, go ahead, the bar should never go forward of the base of support created by the feet. In other words, if the bar is forward of the toes, then the athlete is experiencing excessive flexion in the low back. And up. Now, flexion dysfunction is one thing, but discrepancies in the frontal and transverse plane are even harder on the spine due to the rotary component of these discrepancies. By hanging an imaginary plumb line from the midline of someone's body, or the mid-sagittal plane, if you watch the athlete squat, there should not be a deviation left and right. As you can see by the tape, she's squatting right over the tape. There's no deviation. If there's a discrepancy in the range of motion of the ankle, knee, or hip, there will be a lateral deviation away from this discrepancy. If you see a discrepancy in a squat exercise of any type, where there is a lateral deviation, the exercise should be stopped and the athlete's range of motion should be evaluated at the ankle, knee, hip, and low back. Discrepancies in the ankle, knee, or hip will always overload the lumbar spine, and because there's a lateral shear, there's a coupled motion of rotation and flexion which may quickly degenerate the lumbar discs and or exacerbate any current condition. Medicine balls can be effectively used with the lunge exercise. At this point, I would like to take you through a series of different types of lunges demonstrating how the medicine balls can be used. We will start with a static lunge. From here, you're going to step forward into the lunge. Now, a key feature of the lunge is that if you do not take a large enough step, it is more likely that you will over-translate forward. Okay, go ahead. Bringing the knee past the ankle. Now, some experts believe this is not good because it puts a lot of load on the patella tendon. And they're right, it does put a lot of load on the patella tendon. So in such cases, you need to be very careful about who you allow to do these lunges. If someone has chondromalacia or any sort of patellar tracking dysfunction, you may consider not using this type of exercise, or you may shorten the range of motion. Optimally, to protect oneself, especially when you get into higher levels of resistance with barbells, we're going to make sure that the athlete drops straight to the ground and does not allow the knee to come past the ankle. The exercise can be performed slowly for strengthening, and you can perform it in a dynamic fashion for power output, and then you can go to a step-in, step-out lunge. The box lunge can be effectively used for base conditioning. This lunge is heavily promoted by famous Canadian strength coach Charles Poliquin as an important base conditioning exercise in preparation for the more dynamic, higher resistance lunges later to come with the use of free weights. Here we will demonstrate how to use the medicine ball with the box lunge. An important feature is that when you step onto the box, you must make sure the entire foot is on the box. Many people can be seen performing box lunges with partial foot placement, which will encourage plantar fasciitis. You want to drop down into the lunge, keeping the torso erect, the head and eyes level with horizon, and your goal is to touch the hamstrings to the calves. Once again, if someone has patellofemoral dysfunction, this may be contraindicated. And we will come out. We're going to use slow tempos. Generally, we use a 3-second eccentric, 1-second hold, and a 3-second concentric tempo for strengthening with this pattern of movement. This is very important to include in the rehab or conditioning program of anybody that participates in athletics such as tennis or any other racket sport, soccer, anybody that has to be out on one leg like hockey, where there may be excessive load placed on one leg in imbalanced positions especially. A common fault during the lunge exercise is excessive trunk flexion. Many people will not only flex the trunk, but will look down at their feet during this lunge exercise. The box lunge in particular creates this faulty movement pattern in many people due to the fact that it requires more balance, and the more balance is required, the more people tend to look down at their feet. A trick I've developed to help train people to perform this lunge properly is to place a weighted bag on the head. If the athlete looks down or leans forward, the bag will fall off. As you can see, this encourages maintenance of a good vertical trunk, making the lunge exercise condition the muscles it's intended to condition, which are the glutes, hamstrings, and quads predominantly. Done with poor form, the lunge will look like this. In cases where the weight is placed on the back, the cheat mechanisms are more pronounced with trunk and head flexion, which once again can be corrected with the head bag as a proprioceptive cueing device. The walking lunge is a natural progression from the static lunge. Once again, care should be taken to take a large enough step that the knee does not pass the ankle. An excellent exercise to incorporate in the rehabilitation or sport-specific training program of any athlete that must be in positions where one leg is out in front of their body and the torso must be at a different angle, once again such as hockey and tennis, is a walking lunge with a twist. Prior to starting the walking lunge, we'll demonstrate just a standard step lunge with a twist so that you can better appreciate the mechanics of the lunge. If you're going to step forward with your left leg, you should start the ball at your right side. A common fault with this lunge is that people do not arc the ball in a large enough arc of motion to get good trunk rotation. So pay attention to how Jackie uses a good step in the lunge and a good arc of motion. Now, in cases when you see somebody flexing forward in the back, that oftentimes indicates back weakness. If you see an indicator for back weakness, such as the forward flexion I just mentioned, you may want to take somebody and perform the back toss exercise from the knee position, which will condition the back musculature. The lunge exercise performed with poor technique, which would be demonstrated with an increased flexion at the trunk and short arc, would look like this. And once again, performed properly, once the athlete has mastered the lunge with a twist in place, the walking lunge with a twist would be the next progression.
3, 4, big steps. 5, big arcs. 6.
The jump lunge is the same as the walking lunge, except you're exploding off the ground. It's to develop your quickness. The walking lunge is more of a strength and coordination exercise. The jump lunge is taking the same thing to a higher level and getting your maximum stretch reflex activation out of your hamstrings, glutes, and torso. And here's what it looks like. The medicine ball can be used to strengthen the hamstring musculature very effectively. What many therapists and coaches fail to remember is that the hamstring musculature are predominantly fast twitch muscles. These muscles operate at very high speeds of joint motion, especially in running, where speeds may be as high as 1,000 degrees per second at the knee. What we do with the medicine ball is lay the athlete or patient prone and roll the ball between the legs. As soon as the patient or athlete feels the ball touch the Achilles tendon region, they activate the hamstrings ballistically, tossing you the ball. I highly recommend you start off with only one set of these exercises using a light ball of as little as 4 pounds, progressing yourself up as tolerated. The jumping hamstring curl is an excellent medicine ball exercise for conditioning the hamstrings because it allows the athlete to condition the hamstrings in a standing posture, unlike many hamstring exercises out there. Another nice feature of the jumping hamstring curl is that it conditions the hamstrings at very high speeds of movement, which is hard to do with weight plates on selectorized weight machines because the plates fly up and hit the top of the machine. So what I'd like to demonstrate here is that Jackie is going to drop down into a partial squat, and she will jump up, and when she comes up, she'll convert the stretch on the hamstrings into a ballistic flexion, tossing the ball to me. The knee extension exercise can be performed with the medicine ball as well. I like the medicine ball with the knee extension exercise because it allows you once again to perform knee extension at joint speeds comparable to work or sport situations. To perform the exercise, lean back on a bench or a step, tighten the abdominals to stabilize the torso, fixate the hips, and then the therapist or partner will toss the ball to the dorsum of the feet. The athlete will quickly explode, tossing the ball back. Okay, the jump, kick, pass. You hold the ball between your feet. You're going to come up off the ground, turning your vertical lift quickly into a hip flexion and accelerating the ball. The action at the leg is hip flexion, knee extension. It can be done with a pike for those that are divers or gymnasts that need to practice a pike. For people in martial arts or running sports, the hip flexion, knee extension movement is more applicable. It can also be done with a forward hop. We'll do it without a hop, then with a hop. Good. With the hop, which would be better for track athletes, triple jumpers, long jumpers, etc., you're going to travel with the ball. Okay? Beautiful. I hope you've enjoyed Dynamic Medicine Ball Training, brought to you by EFI Total Gym, Lenny McGill Productions, and myself. For those of you interested in field training with medicine balls, I highly recommend my new video titled Paul Chek's Medicine Ball Training Workout.